The things that are the most important are the things that we all talk about: eating well, meaning fruits and vegetables, and taking good care of yourself, getting rest, and exercising. All of those are very important. When you talk about specific patients, obviously things like hypertension are a #1 cause of stroke. Diabetes does not help. It's not much we can do, but obviously keeping blood sugars in a normal range helps those patients to prolong their vasculature. The smoking is not, then there's the preventables that we shouldn't do: alcohol, smoking, and any type of drugs. They typically tear apart the blood vessels. I say about smoking is one of those ones that basically there's 3 ways that smoking can really hurt you. We heard since the 70s about cancer. Then it became very clear in the 80s that also there was the pulmonary issues, the COPD that people get when they have smoking and they need to be on oxygen. But I think the one that's poorly appreciated by the general public is the damage it does to the blood vessels. It's possible to get away with 2 of those: not have cancer, not have COPD, but it's impossible not to have one of those affect you if you're a big-time smoker. There are other things that, you talk about specific cases. There are things like atrial fibrillation. We talked about irregular heartbeats. Generally speaking, we like to have those patients on anticoagulation because the heart is just not beating like it's supposed to. And as we age, this becomes more frequent. We talked about that. And so making sure that people are aware that if they have an irregular heartbeat, they may not be aware that they have that irregular heartbeat. So going to your doctor, I'm to blame for all of these things. I don't sleep as much as I should because I'm working, and I try to eat as well as I can, but it's not always perfect either. But going to your doctor and making sure you don't have an irregular heartbeat. They also listen to whether or not you have blockages here in the neck. These are important things to get checked and to understand so that you understand your risk factors. If you have a family history of stroke, then it's important to start that earlier than if you didn't. Because if you have a family history of stroke, genetics is the #1 thing. You can eat as good as, I grew up in Southern California, right around the corner from the Pritikin Center, which was, if you know anything about that, that's the absolute no cholesterol, health, you can't eat a piece of meat because it's dangerous type of philosophy. And you can be in that Pritikin group and you can still have atherosclerotic disease if you are genetically predisposed. So genetics plays a big role. So if you know that both your mom and dad had heart attack or stroke, then that should make you understand that you probably should go to the doctor a little earlier and get checked out, and make sure that you don't have the blockages in the neck, or you don't have something wrong with your heart. And then the other one is that some patients do have thick blood, and that's also a genetic factor as well.